So if people weren't on edge before about the COVID-19 pandemic, this news isn't going to make things any easier. As you mentioned, the province has confirmed cases of a new variant that experts believe will transmit more easily than the original strain. Now, earlier we spoke with health experts to find out what this means for you, the viewer, and if this could have been prevented.
They haven't been in Britain and they're not associated with anyone coming back from Britain. So what that does suggest is that this variant may be circulating within our community.
Ontario saying late in the afternoon that a new case with the COVID-19 UK variant was detected in Ottawa. That individual had traveled to the UK recently. The province also confirmed that the first known cases carrying the variant are a couple from Durham region east of Toronto who had been in close contact with a recent traveler from the UK. That detail had not been disclosed in previous interviews. Their close contacts have been informed.
If they haven't traveled, it means that this variant has been in the community and has been being transmitted in the community for a period of time. And that's not unexpected. It's just whether or not people who might have been transmitting it might have been asymptomatic, so they wouldn't have been tested and so it wouldn't have been picked up.
The feds released a statement today saying that on December 20th, flights were suspended from the United Kingdom for 72 hours and was extended until January 6th. The province says they are prepared to start COVID-19 testing programs in airports, but need support from the federal government. So far, if you travel, you are asked to quarantine, but experts say more needs to be done.
Here's my concern all along is, what has Canada's plan been for variants or mutations? We're in the middle of a pandemic and, hopefully this variant doesn't make people any more sick. We don't know yet, but it doesn't appear to make people any more sick, but it does appear that it's far more contagious. So remembering there's this one, meaning the British one that's now here, there's a South African variant and there's a Nigerian variant. Those are not known to be here at all, and there could be more very, very easily. The concern is, we have to do surveillance. So what I mean by that is they actually have to do genetic sequencing when they find the virus to look at the genetic sequence of the virus so that they know which one it is. And we're doing a little bit of that, but what we're not doing is really checking people coming in at the airport, for the virus at all, or sequencing to see what's coming in.
Health Canada also says that only about 2% of all cases in the country have been traced back to travel. The province's own data shows travel cases are far behind transmission due to close contacts, community spread, and outbreaks throughout the pandemic. As for the variant itself, there is still little data with regards to it, but pharmaceutical companies say the existing vaccines are expected to be just as effective to combat it. Experts say this news only drives home the importance of the lockdown and why people need to stay vigilant with COVID-19 safety measures until a vaccine is made accessible across the province.